Hello and welcome to the first proper episode of Inspiring Women Leaders. Yep, not just me with a monologue. I actually have a guest. I'm doing an interview. So I am so super chuffed. I can't even tell you to welcome to the show. It's my first guest, my friend and fellow physician, entrepreneur and coach, Dr. Neka Unuchukwu. There are not enough words to describe or explain how incredible a person Dr. Unuchukwu is, but I will start with her bio, which has been supplied to me. Dr. Unuchukwu is a board certified pediatrician and the founder and CEO of Ivy League Pediatrics outside of Atlanta, Georgia. She graduated from the University of Nigeria College of Medicine and completed her residency in New Jersey before opening her own practice. After honing her entrepreneurial skills, Dr. Una, as her coachees and mentees, which includes me, all affectionately call her, created the EntreMD Business School, podcast to go with that, and community to help physicians build personal brands around their expertise, to open practices and develop product lines. Featured in Forbes and a member of the Forbes Business Council, she has helped doctors all over the world leverage entrepreneurship to build lives they love. And I am one of those international doctors that she has helped. I think it really is an understatement for me to say that Dr. Una is leading the way with inspiration. So without further ado, let's meet Dr. Una. Welcome to the show. Thank you so much for agreeing to come. Thank you so much for agreeing to come on and speak to the show's audience. I am so truly honored and blessed. Thank you.
Well, I'm honored to be here. Thank you for inviting me, and I'm feeling like a real VIP. I'm your first, interview guest. So this is amazing. But thank you for inviting me, and thank you for what you do. This is such an important conversation to be had.
Well, thank you. I mean, it's all about you guys, the guests, and the expertise that you can bring. But yeah, I'm so grateful to have brought this vessel to showcase your amazing knowledge and skills. So, okay, so I've done the introduction, but in your own words, a bit more informally, can you tell the audience a bit more about yourself, including what your current work roles are and what leadership positions you currently hold and have held in the past, please?
Yeah, sure. So, like you said, I'm Neka Unachukwu. Of course, everybody calls me Dr. Una, including my sister for obvious reasons. Um, I am, on the personal side, I've been married for 16 years. I have four kiddos. I homeschool the older two, who are 14 and 12. And, professionally, I'm a pediatrician. At this point, I am on a sabbatical, so I have not put my hands on patients in the last 5 months. But I do run my practice. I'm very involved with it. But, I show up there as the CEO of the practice. That's the role that I'm in now. And then I spend most of my time doing what I love, what I consider my legacy work, which is what I do with EntreMD. EntreMD is a company that I started almost 4 years ago, and the goal is simple: to help doctors build profitable businesses, whether those are brands, private practices, other kind of services, nonprofits, product lines, and so that we can literally take back control, right? So we can live life, practice medicine on our own terms, especially because we live in a time where, especially in the US, we're talking loss of autonomy, doctors going like, do not go into medicine. That is a recommendation of most physicians.
Yeah.
There's no financial security and all of that. And it shouldn't be so. We are only one skill away from being able to turn that around, and that's business skills. That's the missing link for us. And so I do that through the podcast, the EntreMD podcast. I had a new baby recently, the EntreMD Method book. Um,
Yes, I
and then
have
the
it. I have it.
EntreMD. Yeah, I have your picture with it. Thank you so much for getting a copy and spreading the word. And then the EntreMD Business School, which before I used to say was my year-long program, but we have people who are going on their third year in the school, so I'm not sure what to call it. But it is a place for doctors who are all in, and they get the coaching and accountability, and the community they need to thrive as physician entrepreneurs. So I'm the CEO of two companies. I think at this point I would say what I'm trying to do is be the leader of a movement of change in the physician
Mm,
community. That's probably the role I identify the most with.
yeah, yeah. Well, I mean, I think it definitely is a movement. You are a visionary, and you have class, kind of people in your class from all over the world. It's truly international, and I think what strikes me is that you're doing all of these amazing things. You're CEO of two companies, and you have other businesses. I think you've told us in the past, and you have four kids, and you're homeschooling two. Now, a few months ago, my kids got COVID. I had to homeschool them for a week. I didn't have any hair on my head. It's growing back now, but I was pulling my hair out. I just don't know how you managed to homeschool two
Well,
kids and do all of this. You are
if you
amazing.
noticed, I said I homeschool the older two.
Yeah.
The younger two go to school because I will not have any hair left. So
Yeah,
you're okay.
very good reason for that. Yeah. But yes, I mean, what you say about the community you've created, I mean, honestly, it wouldn't be if it weren't for the community. I don't even think this podcast would be a thing, would be a concept, because I was in the school for about 9 months, and I made such strong connections with my fellow students, my fellow classmates, and a lot of whom will be coming on the show and have been inspirational to me as well. So I mean, yeah, you are just creating something. It's magical. It really is. And I just needed you to come on the show to show aspiring leaders in medicine and other professions what is possible. So thank you. So, I mean, I could speak to this, what I think of your leadership style, which I think is amazingly great. But how would you describe your personal leadership style?
I think my leadership style is, I guess it's what you'd call servant leadership. It's not really, leadership is not really about accomplishing things. It is helping people accomplish things, creating win-win situations, right? Like we work together. I'm the leader, but it works for you, it works for me. I think about it as taking the responsibility of creating a vision large enough that the visions of the people you lead can fit in it.
Yeah.
Right.
Yeah.
And so if you think about, what I do with EntreMD, I'm really wanting to bring a shift, like a disruption to the healthcare space. And that so physicians can go back to being the leaders in the healthcare space, being the people who love what they do and having financial security. But that is big enough that other people's visions can fit in it.
Yep.
Right. And so we're working together. It works for you. It works for me. Everybody comes out on top. I'm really committed to seeing whoever is in my orbit, whoever I lead, becoming the best version of themselves. That's my job.
Yep.
100%. And so I see my leadership that way. It's creating win-win situations. It's not about having a position, having things your way, and other people are at a disadvantage, or they're not really going to start their lives until they walk away from working with you because you're stifling them. You know what I mean? And so it's creating win-win situations.
Yeah. Yeah. No, that's great, because obviously there are some leaders who sort of smother people if they feel threatened by them. But your vision is ever expanding as your students' visions get bigger. Then so the space that you hold for them has to get bigger. And that's kind of how I see what's going on. And I've learned from you, that the wins, there has to be a win for, in my case, the coach has to be a win for the client. Win podcasts, there's got to be a win for the audience, a win for the guest, a win for the host, and it's everybody wins.
Everybody wins. And when everybody wins, as a leader, you can have the biggest impact. You can have the biggest following, because it's true, it's authentic, it's genuine. It's a game changer for people, and it's the best kind of leadership.
Yeah.
It's the best, and everything you touch becomes your legacy work. There's nothing that's just meaningless work.
Yeah.
Because you leave people different. It's like what you're doing with your podcast. You're creating wins for the people who are listening, right? You're creating wins for your guests, because I'm going to be able to talk to people who maybe our paths would never have crossed,
Yeah.
right? And then you read my bio, and I feel really good.
Yeah.
Right?
Yeah.
You
Yeah.
know? And then for yourself, the impact of you creating wins for your guests and your audience is that your brand grows and your influence grows and your reach grows and people know, like, and trust you more. Your business grows and all of that. And so with that style of leadership, nobody's taking advantage of anybody.
Yeah.
Nobody's leaving with a sour taste in their mouth. Everything
Yeah.
is good,
Yeah.
so it's a beautiful place to be.
Yeah. Yeah. Absolutely. Yeah, love that. Thank you. Um, so, in terms of your journey to leadership, if I recall correctly, when you qualified as an attending in pediatrics, you did work at another clinic for a while, didn't you? Before you set your own
I,
up.
yeah, I worked for about 12 months thereabout
Mm-hmm.
before I started my own practice. Yeah.
Yeah. So it was a pretty short journey to becoming CEO of your own clinic, right? So, well, maybe talk a little bit about the EntreMD side of things and your kind of, your leadership journey to that, to becoming who you are now, because you said you set it up 4 years ago. So
Yeah.
how has that role kind of like evolved?
Well, so this is the deal, right? I need to take you to the version of me that started any of these things. All right. So I was the socially awkward, super shy, introverted introvert, lots of insecurities. Um, and so I didn't see my name and leadership in the same sentence, right?
Yeah.
And so when I, for instance, when I started my practice, um, I would in the beginning I didn't hire anybody
Okay.
because I was like, how am I going to lead? Like, I'm going to lead a team. How am I going to
Mm.
do that? And then I'm going to pay the team, which is a whole other, we're going to need a whole other podcast episode for that. Okay. Right. And so I answered my own phones. Like, you won't believe, I answered my own phones. I created an alter ego. Her name was Ella. And so I'm like, thank you for calling Ivy League Pediatrics. This is Ella, right? Ella was me. Okay. And so I answered my own phones. I did my own vitals. I saw the patient. I did the billing at the back end because I hadn't grown into being a leader. I didn't really think people would follow me. It's very
Yeah.
strange, but that's kind of where I was. And then that's when I discovered I really went hard on personal development. I did a lot of stuff by Brian Tracy. Now we're talking 2010, so it's very different from now. I didn't even know what a coach was. Like, you know what I mean? There were not a lot of there were no physician groups. That was not a feature on Facebook. You understand what I,
Yeah.
like, this
Yeah.
was, you're on your own, figure it out.
Yeah.
And so I learned a lot about hiring, building company culture, leading a team, and all of that stuff from some resources that he had. And then I started embracing that. I grew a team. But even at that, because you grow in levels of leadership. So I
Mm.
had the team, but I had a really hard time holding them accountable. I really had a hard time sharing my vision and
Mm.
inviting them to take seats on the bus in my vision. You know what I mean? Because
Yeah.
I was like, who am I to tell them what to do? So we worked and we, saw the patients and all that went away. But I wasn't standing as an authentic leader because I wasn't taking them where I wanted to go.
Yeah.
You know what I mean? So that was for the private practice. And so for 6 years, we're doing really well. I've seen patients 4 days a week and all of that. And then this whole there is more thing came back, right? As like, there has to be more.
Mm.
And then so I started this EntreMD journey. I think the word I can use to describe it was I was embarrassed. Because I was like, you're going to call yourself a coach and you're going to lead people? Like,
Mm.
Tony Robbins is a coach and you're a coach. I'm not understanding what you're talking about, right?
Yeah.
And again, this was in 2016. There were some physician coaches, but this was not an acceptable thing per se. There
Yeah.
were not many of them.
Yeah.
And so it was hard to show up as a leader. It's hard to show up as a leader when you're embarrassed by
Yeah.
what you represent and all of that. And so I had to work on the value that I bring. I had to work on the vision, owning. And I think that was one of the best things I did is I really sat with the vision of what I wanted to accomplish. Right? I'm like, I want to help. 100,000. At the time, I said 80,000 people because I wanted to help 10% of the physician community. So at the time, it was 800,000. And so I
Hmm.
want to help 80,000 physicians learn how to build businesses so they can have their lives back. They can
Yeah.
have the freedom to live life and practice medicine on their terms. And it was the vision that got me, that put me in a position where I was willing to lead. I was
Yeah.
willing to talk about my vision. I was willing to tell people, come follow me. I was willing
Yeah.
to tell people, let's build this together. And so for me, a lot my challenges were all, they were just internal.
Hmm.
They were internal all the way. And I'm still, I don't think leadership is something you attain. Like, now I'm all the leader I'll be. I think there's a constant evolution,
Yeah.
and I'm still working on it.
Yeah.
Yeah. But
Yeah.
owning the vision, I think, was what made the biggest difference. Sitting with that vision, living it, breathing it, sleeping it.
Yeah.
And I was like, I cannot not do this.
Yeah.
Yeah.
Yeah. Yeah. It was a calling.
Yeah.
Yeah. Yeah. True calling. So can you just unpick a little bit more about the mindset then, the kind of the fears and kind of how that affected you initially?
Yeah. So, I mean, the fear is basically, I don't even know if it's not even just that it affected me, it stopped me. Like,
Uh-huh.
the leader me just didn't show up,
Yeah.
right? Because I was afraid of being rejected. I was afraid of having my ideas rejected because I had not made the difference between my ideas and me. And so if
Hmm.
somebody rejected my idea, they rejected me, which is not true. They just
Okay.
rejected my idea, right?
Yeah.
And so that fear was there. The fear that I was not the kind of person people will follow,
Okay.
and so if they're not going to follow me, then I'm just not going to show up. So
Yeah.
I just didn't show up.
Yeah.
And for everybody listening, I think one of the best things we can do for ourselves is become everything we have the potential to be, right? And fear will try to stop us, all along the way. And Dr. Adam, you've read my book, so you know my stance on fear. I tried for years to get rid of this fear. Like, I
Mm.
cannot wait till I'm free of this fear so I can do what I want to do.
Yeah.
And one day I was like, I don't know how old I was, but let's say I was 35. I'm like, Dudette, you are 35 years old. And this fear is still here.
Yeah.
So clearly it's not planning to go anywhere. And we don't if I live to be 90, 100, 120, I'm burning daylight regardless. I'm
Yeah.
not going to live forever. And so I made a new decision, and the decision was this: I'm going to stop fighting fear. I'm going to let it stay right there, and I'm going to do what I want to do anyway.
Mm.
The last thing I want to do is be at my 90th birthday when I don't have the time and I don't have the strength to chase after my dreams
Hmm.
and realize that I didn't do it.
Yeah.
And I could have, but I didn't.
Yeah.
I don't want to do that. So I tell people I've done everything I've done afraid. I do my
Yeah.
podcast afraid. I do the business school afraid. I throw live events with 500 people registered afraid. I do it all afraid, and I don't care.
Yeah.
I'm not waiting for the fear to go away anymore. I'm good.
That is powerful. Yeah. That's really strong. I mean, yeah. And when you start to shift your mindset like that, you start to get into the realm of empowerment. But yeah, I mean, gosh, I'm 47 in July. I've just launched a podcast. I've been thinking about it for, it'll be 3 years in August. I only got around to doing my website in March, having been coaching for a couple of years, because I was afraid to set out my stall, show my shop window to the world. What's going to happen? People are going to come at me. I'm going to get trolled, and people are going to hate me and not think I'm any good. And that the age of 40, 45, 46, still have those fears. But you're right. You just have to It's a bit cheesy, but embrace the fear, I suppose,
Embrace
and
the
just kind of
fear.
use it. Yeah,
Like hug it. Say,
yeah,
come on.
yeah,
Like you can stay here, but you don't vote anymore. Your voting rights have been revoked.
yeah, yeah,
You know what I mean?
yeah,
And really for anybody who's listening, because sometimes what this does is it provokes a lot of regret. Like, oh man, what if I had done it at 20? What if I had done it at 35?
yeah,
Right? And I have a philosophy with regret that I think will be helpful to everyone who's listening, and that's this. If you find out there's something you could have done 10 years ago that you didn't do, there's no point spending the next 2 years wasting time thinking about what you could have done that you didn't, because there's
yeah,
absolutely no way to reverse that.
yeah,
Right. And so what I do so that I don't live in regret at all, because I don't live there,
mm,
is I find somebody else who is currently making the mistake I made, and I help them not make it.
yeah,
And so because of that, so for instance, I may say, so that you're saying, oh, I wanted to start my podcast 3 years ago, but I started it today. But imagine that 5 other people start podcasts 3 years earlier because of you.
mm,
That's even better than you started 3 years earlier. You know what I mean? Because
yeah,
this is your legacy. This is how your life changed the world. So what is there to be sad about? You just converted what you should regret into a lesson and taught it to somebody else.
yeah,
Boom. And
yeah,
so I don't touch regret with a 10-foot pole. It's such a negative emotion.
yeah, yeah. That's great. No, that's a really good way of looking at it. And the other thing is, and this is something that has come from listening to your podcast, and that's how I first heard you on Erin Wiseman's podcast, and then I just consumed all of your episodes. And I remember you talking about your inner critic and how you dealt with your inner critic. Is her name Vicky? Was it
Vicky,
Vicky?
yes.
Because that, like, Vicky and other names are available, but yours is called Vicky. Um, she was a thorn in your side, a pain in your behind, yeah. So she could have kind of like stopped you on your leadership journey. How did you manage her? How did you quieten her down?
So this is the thing. I thought Vicky and I were one and the same. Like the constant, like, oh, you can't do this. Oh, you can't do that. If you go speak at that event, you're gonna lose your words. You're gonna put that program there, nobody's gonna sign up, and you're gonna do this, and people are gonna boo you. Oh, and the negative reviews that you're gonna get. Oh, you're talking to that person. Look at how they're looking at you. They're like, what is she talking about? Like she's making no sense. Relentless,
Yeah.
relentless. In fact, I'll tell you one that's really funny. I spoke at a conference, the Brave Enough conference, put on by Dr. Sasha Shilkut. And this was about 9 months ago. Okay. So this is recent. Okay.
Mm.
So I'm sitting in the audience. I was going to be speaking the following day. No, I was going to be speaking that day. Okay. But the speaker that went before me was already there doing her thing. And then Vicky starts. Oh, you see that little cord? It was like an electrical cord. You see that cord before the stairs to get on stage? You're going to trip on that and you're going to fall. And you're going to hit your teeth on the edge of the stairs and you're going to lose 2 teeth. And there's going to be blood everywhere. And knowing you,
God.
you're going to be like, I'm still going to do my talk. And Sasha's going to be like, you're bleeding. You can't do it. Like, go take care of the bleeding. And then you won't speak anymore. Can you imagine how ridiculous that conversation is? And this is 9 months ago, okay? And
Yeah.
I've done a lot of work on my mind and all this. And I'm just saying that to say it's normal. And I'm an Enneagram 6. And I heard somebody describe in a way that made me go like, oh, so I'm not abnormal. He said, these are the people who have pre-traumatic stress disorder. Like nothing has happened, but they
Yeah.
have imagined 100 scenarios of how everything can go wrong. And they're terrified about something that most likely will never happen.
Yeah. Yeah.
Right? So I need you to imagine me for years not realizing that these are not my thoughts.
Yeah.
You know what I mean? This is not me, right?
Yeah. Yeah.
And so the power in naming Vicky for me was that you are crazy and I am not, right?
Yeah.
Like, is that distinction between, all these crazy thoughts. So
Yeah.
when the crazy thoughts go, I just recognize there will always be crazy thoughts.
Yeah.
But I'm very clear that those are not my thoughts, and those will not stop. And those, I do not make decisions based on that.
Yeah.
Because before I did,
Yeah.
right? Oh, you're not the kind of person who can speak, then I wouldn't speak.
Yeah.
Oh, you're not the kind of person who can build, like with the business school. It was like, oh,
Mm.
hang on. Harvard has a business school. Emory has a business school, which is the big university in the state where I live, and you have a business school? Like, who's fooling who? What is going on here? Right? But at that point, I had already realized like that is not going away, but that
Yeah.
does not get to vote.
Yeah.
Right? Like,
Yeah.
I can hear it, it can be in my mind, but it doesn't get to vote. So yes, I heard it. Yes, I still started the business school
Yeah.
because Vicky doesn't get a vote anymore.
Yeah.
So for me, it was just the power of separating that narrative that's
Yeah.
not going to go away,
Yeah.
and just taking away its power to vote. So I can feel fear, I can hear all of that and still do what I'm supposed to do.
Yeah.
Yeah. So maybe some people have gotten rid of it. Not a thing for me. And
Yeah.
I was like, I'm not waiting for this one more second. I'm
Yeah.
and
Yeah.
I've been in the room with some people who are really powerful CEOs running $500 million companies and all of that. They
Mm.
still have the same narrative going on in their heads.
Yeah.
And so I was like, wait a minute. They went all the way to 500 million. They're still just thinking these crazy things.
Yeah.
We might as well just do what we need to do and
Yeah.
stop trying to make it stop.
Yeah.
Yeah.
Yeah. That's great. So, I mean, you described the kind of embarrassment earlier on in your career, the fears, lots of fears, um, and the negative mind chatter, the Vicky and so on. And you've explained beautifully how you've navigated all of those, because these are things that will trip up wannabe leaders for sure. I'm too embarrassed. I can't possibly ask someone to do something, or I'm too afraid to do that, or yeah, my Vicky or whatever is in overdrive. So that's fantastic. All very real potential scenarios with practical ways to navigate them. So thank you for that. So, in addition to that wonderful advice about kind of dealing with your own internal challenges, do you have any other advice for our listeners on how to become strong and kind and compassionate leaders?
I have two, maybe. Let's do two. I'm generous.
You can have a third.
Okay, okay. Look, you started it. 3 hours later, I'll still be going. I'm kidding. I think the first thing is to recognize that you're not static. You're dynamic. So when I started off my private practice, I felt like I was the kind of person who could not run a wildly successful private practice. I didn't have any business training, didn't have the experience. I just couldn't, right? I was shy, I was an introvert, and all the things. And so when I looked at people who had really great practices, my conclusion is they're great at that, and I am not. The end.
Mm.
And when I went on my personal development binge, then I heard Brian Tracy make a statement that, not heard, or I read it in a book. He said, all business skills are learnable. That was such a pivotal moment for me. All business skills are learnable. I'm like, hold up. I'm a physician. If there is anything I can do, I can learn, right? And that automatically meant that the people who had those bigger practices were not better than me. They just had skills I didn't have. And you're not born with skills. I can acquire them.
Yeah.
And so what that means is, as a leader, don't think that where you are is a lid or you're capped. You're not. You can become better. You can become like the leaders you are inspired by. You can become, the leader that you've had the vision that you can be. You are not static. You are dynamic. You can change. It is so critical that we understand that.
Yeah.
And when you think about it, the human potential, nobody really knows what the cap is. Okay? If I told you 10 years ago that a man is going to be trying actively to put people in Mars, you would have been like, what is this, a sci-fi movie? What are you talking about?
Mm.
But we have somebody who's actively trying to do that.
Yeah.
Do you see what I mean? So
Yeah.
I say that to say nobody really knows what the end of our potential is.
Yeah.
So you might as well own your dream and chase it down because it's within reach, right? But you can change. You can. The second thing is a little more overarching, and that is it's so easy to get distracted in the day to day because the day to day is full of challenges and, shiny things and social media and all of the things. One of the things that's kept me, I think, on the straight and narrow is the relationship I have with my 90-year-old self. And I
Mm.
think everybody should cultivate that. Now, in a lot of people do this exercise where they tell you, "Oh, think about it being your funeral, and someone is reading about you. What would you want them to say?" For me, it was just too morbid for me to
Yeah.
attend my funeral that many
Yeah.
times. I'm just like,
I
yeah, I'm not
agree.
going to do that. No, it's too much. It's too
Yeah.
much. And so, not that I'm scared of dying, but who wants to relive their funeral like a
Yeah.
gazillion times? And so I replaced it with my 90th birthday. Okay. See, that's happy. So
Yeah.
at that birthday party, someone stands up to read about your life. What do you want them to say? Like, really think about it. Take time and write it down. Attend the party. Imagine what you're wearing. Imagine the people there. Imagine your family around there. Imagine the people whose lives you've impacted there. And they get up to read this thing about the different areas of your life. What do they say? Then, when you're done defining that, come back and start creating that.
Mm.
Now, as what does that have to do with leadership? As a leader, it will make you own your vision.
Mm.
It will make you pay the price to become a better leader. It will make you realize how important it is to invest in people because money is important, but it is not more important than people.
Mm.
Money is important. It is not more important than the legacy that you leave.
Yeah.
Impact is the biggest currency,
Yeah.
right? And so that kind of puts that in perspective and helps you make decisions that matter in the long term, not just decisions for the short term, right? So building that relationship with your older self, your older, wiser self that has shorter time,
Yeah. Yeah.
makes you make really wise decisions now.
Yeah.
And so yeah, those are the two things I would say.
Awesome. They are very wise. Thank you. Yeah. No, appreciate those. Okay. So I suppose, have you got any kind of, in a nutshell, take home leadership messages for the listeners?
You are the center of gravity of your life. Change you and everything changes. It's easy to blame
Mm.
situations. It's easy to blame people. It's easy to blame your upbringing. It's easy to blame everything on the
Yeah.
outside. And those may be valid. So it's
Mm.
not that it isn't. It's just that when you change,
Yeah.
everything changes. And so you may be leading people that are giving you a hard time. Do you know I've learned that it's the leader? Like, all
Yeah.
my staff are crazy. They're all led by you. You hired them. You kept them.
Yeah.
Right?
Yeah.
And so if you
Yeah.
get better at hiring, you get better at business building culture, you get better at de-hiring, everything gets better. So the rate limiting step, the center of gravity, all of that, it's you.
Yeah.
And so do everything you can to make you better. Do everything you
Yeah.
can to take 100% responsibility for your life and the outcome of it and
Yeah.
make it what you want it to be. Make you
Yeah.
better. Yeah, it's all you. It's all me. Yeah.
I love that. That's very profound. Yeah, that's great. I'm gonna let that percolate over the day. I love that. Thank you. Okay. All right. Well, can you tell us what you're currently excited to be working on that you'd like to share with the listeners?
Oh, I'm always working on something, Dr. Adam.
That is the truth.
Always working on something. Well, let's see. So in the EntreMD world, so in the EntreMD world for this year, at the time of this recording, 2022, we have one mission. And so the mission is the mass business education of physicians. Why? Because I know that that is the missing skill, right? That's the missing piece in our education. And once we get that right, everything else falls in place. So we are striving to build a time where, doctors are the leaders inside and outside of the exam room. Doctors fall in love with practicing medicine again, and doctors have financial security. So this is our overarching mission. And so of course, we're doing that, with the EntreMD podcast. So we're pushing that into as many ears as we can. We're doing that with what we call the $16 MBA for physicians, which is the EntreMD method book. So we're
Yeah.
pushing that in as many hands as we can. Grateful it got to your hand, Dr. Adam.
The day
And
was
then
released, I think.
yeah, I think so. And, so we're pushing that. We have our annual event on TRMD Live, which is happening June the 16th. So we're trying to put thousands of physicians in there. So it's all mass business education. And then, of course, with the OnTrMD Business School, it's always about how can I help them build those 6 and 7 and multiple 7-figure businesses faster and better. Yeah.
Yeah.
So, and it's all with one mission, mass business education, because we're gonna topple the healthcare space, totally disrupted. It's that time for physicians.
Yeah, definitely. I love that. Love that mission. So if any of the listeners would like to reach out to you, what's the best way for them to do so?
Yeah. So they're already on a podcast platform, so they can search EntreMD, ENTREMD, and we can always continue the conversation there, and then everything else would be on my website entremd.com.
Yeah, brilliant. And I'll put those links in the show notes. Do you have any closing words that you'd like to share with the listeners?
Yeah, subscribe to Adam's podcast. Subscribe to the podcast and share it with the female leaders and aspiring leaders in your life. And I don't say this because, well, that's a cool thing she should say, but the truth of the matter is this. Um, every person is one mindset shift, one thought away from a big breakthrough, right? And so what you do is you're really featuring female leaders, and it's not this cute Instagram reel of everything working. This is you pulling people, and they're sharing the challenges, they're sharing the wins and all of that, and so people can experience it. So what it does is it makes them say, oh, these wins are possible for me, and these challenges are normal. And
Yeah,
I mean, that is a game changer, because
yeah, it is.
I thought I had some big issue, right? Like, oh, I have this negative chatter. But after listening to me, you're like, oh wait, they all have this negative chatter. So
Yeah,
I don't need to be bent out of shape because of it. This is a human experience,
yeah,
right? Which, think of how transformational that could be for somebody. So really, I mean it. Subscribe to this podcast and share it with the female leaders and aspiring leaders in your life, because this podcast can be the catalyst of change for them. And you are the one that was a catalyst for the catalyst. And that's your legacy. So do it. Yeah.
yeah. Uh, thank you for that. And obviously, I didn't ask Dr. Una to say that, but no,
But it's
I
the
mean,
truth.
yeah, it's yeah. I'm ambitious for the show. I think it could be transformational, as you say. It could really help give practical know-how to aspiring leaders, and make the next generation of leaders way better. And for our children, for our daughters.
Yeah.
It's really important to me. So, um, well, I think all that remains to be seen is thank you again so much for coming on my show, sharing all your wisdom and wonderful advice with the audience. There could be no one else to be my first guest. You have been a huge inspiration for me, and you've been instrumental. And I said before the show, um, I I wouldn't even conceive that I could have a podcast of my own if I hadn't started listening to EntreMD, those 2.5 years ago or whatever. And you just continue to inspire me and classmates, and I'm inspired by what they do. So thank you for everything you do, and thank you for being my first guest. I'm so honored, genuinely.
Thank you so much for having me. I'm going to be bragging about this for a long time. They're like, oh, look at what his podcast is. I was like, I was the first guest. Did you see my episode?
I hope
I'll be
so. I hope you
bragging
can
about
dine
it.
out on it.
Oh, no, I will be bragging. Just watch.
Fantastic. Well, thank you again and have a wonderful day.